So I wrote this paper. I was thinking about this year's topic and what would be appropriate. And I thought, in medical ethics, people talk all the time of 4 different principles: autonomy, beneficence, non-maleficence, and justice. And what you find is autonomy tends to be the dominant principle. It tends to trump the others when they're in conflict. And, in the early years, autonomy was cited or appealed to mostly to justify informed consent. But these days, increasingly, it's being appealed to justify a much wider array of services, some of which might generate concerns for Orthodox providers, or professionals is a better word. And so I asked myself, how should Orthodox Christians think about patient autonomy? And so that's the theme. In his spiritual homilies, St. Macarius of Egypt declares that the image of God is presented in liberty, free will, and the faculty of choice, which cannot be destroyed by sin. This freedom demands to be respected. St. John Chrysostom, in his 6 books on the priesthood, says, "You cannot treat men with the same authority that the shepherd treats a sheep. The decision to receive treatment does not lie with the man who administers the medicine, but actually with the patient. For Christians, above all men, are forbidden to correct the stumblings of sinners by force." And if we look at the Gospel of Luke, which tradition says, he was a physician, we see that the word heal appears more than 30 times. And what you notice is that in nearly every case where Jesus heals, it's preceded by words such as, he asked, they begged, they came to be healed. As St. Porphyrius observes, referring to the book of Revelations, Christ stands outside the door of our soul and knocks for us to open to him, but he does not enter. He does not want to violate the freedom which he himself gave to us. God respects freedom. But what kind of freedom? I believe the kind of freedom that Orthodox Christianity fosters and respects is simply the act of choosing, willing, or assenting to an option. This is very different from many modern ideas of freedom. Kant, who's probably been the most influential philosopher in the area of ethics, his view is this. He says, what else then can freedom be but autonomy? It is the property of the will to be a law unto itself. And that's exactly what autonomy means in the original Greek, autonomos, self-law. I'm aware of only one passage in scriptures that evokes the notion of self-law, one very different from Kant's, and this is St. Paul. Indeed, when the Gentiles who do not have the law do by nature things required by the law, they are a law unto themselves. That is to say, the only sense in which we are a law for ourselves is when we do things required by God's law, which is written in our hearts. Recall that in the same epistle, Paul teaches that through Christ Jesus, the law of the Spirit who gives life has set you free from the law of sin and death. And he clarifies just what sort of law this is. Those who live in accordance with the Spirit have their mind set on what the Spirit desires. That's really what this law is, having your mind set on what the Spirit desires. So bearing this Orthodox vision of freedom in mind, we'll turn to some questions of healthcare ethics. I'll draw a few conclusions, but honestly, in many ways, I feel the value of this exercise is understanding. It's not necessarily to make war on autonomy. I agree with Deacon Dr. Nash that, we don't need more culture warriors right now, but we do need to understand the context in which we operate. And I think we also need to find ways to protect our integrity as healthcare professionals. So I'm going to start with this. Are healthcare professionals obliged to treat people who do not want to be treated? This one's a bit easier, and I think it's already been touched on here. Ordinarily, no, precisely because we respect freedom. It's one of the reasons, at least. In this regard, healthcare workers truly mirror God's relationship to us. One could ask whether a gravely ill patient sins in not accepting that all medicine can be provided. Accepting all medicine that can be provided. And it was noted already, in the Roman Catholic tradition, there's a sense that you must accept treatments unless they're extraordinary, unless they're going to be futile or overly burdensome. But this really is not the Orthodox way of thinking of this. And I think one of the most beautiful illustrations of this comes from St. Porphyrios, who, remember, his prayers for the healing of others were so often answered, and they experienced complete healings. But what he wrote was this: among all my other illnesses, I also have cancer of the pituitary gland. I'm in great pain, but my illness is something very beautiful. I feel it is the love of Christ. I do not pray for God to make me well. I pray for him to make me good. I'm certain God knows I'm in pain. I'm not taking medicine, nor did I go for surgery. I will leave it to God to sort things out. Now, I feel certain the saint would not condemn someone for pursuing cure at the hands of medicine. The point's rather that, contrary to Kant and most ethicists, what is right according to the desire of the Spirit is often what's right for us as individuals. In the field of medicine, like God, should honor those who refuse treatment, at least when the patient has decisional capacity, and doing so will not place others at risk, and cancer is not contagious. But this leads us to the most urgent questions that confront Christian healthcare professionals today. Must all patient demands for interventions be honored? And I think the obligations that healthcare professionals have toward patients derive largely from the purpose of medicine and its nature as a profession. So to be a professional is to have specialized knowledge and skills and to profess something publicly. You're committed to something. In this case, in healthcare, what's typically professed is a commitment to preventing illness, treating illness, and palliating when we cannot treat. This is what patients have traditionally expected of healthcare professionals. But in reality, for a long time now, physicians in particular, because they can prescribe and perform surgeries, frequently provide services that go far beyond the customary purposes of medicine. So in the light of these two clusters of demands, and I'm going to check on time here. I'm fine. 3:06. Thank you. I want to consider two questions. One, is there an obligation to treat that which is treatable? And second of all, how do we respond to demands for services that are not meant to prevent or treat an illness? So the first may seem more obvious, but I want to touch on it because it just reminds us of where our real obligations lie when we look at other appeals. So at first, if we ask, must professionals meet the demands for the treatment of treatable illnesses? This seems like an easy question. Yes. Ordinarily, healthcare professionals should treat illnesses that can be treated. And Father Anthony Rober, who's with us today, he's examined the explosion of rights in the U.S. context very recently in a book with Fordham. And some of these rights are state-granted and surely not rooted in human nature. But others are alleged to be basic human rights, such as the right to health care. And philosophers have tried to ground these rights in the concept of human dignity, frequently on the grounds of particularly noble human traits that we usually do not begin life with and often do not end life with, including free will and rational thought. A more secure foundation for recognizing a right to health care is to view it less as something owed in justice and more as something God requires us to do, as an extension of loving our neighbor as ourselves, and as something explicitly enumerated by Christ. Then the king will say to those on his right, "Come, you who are blessed by my Father, take your inheritance, for I was sick and you looked after me." Nevertheless, healthcare professionals struggle in many cases because they're simply not in control of all aspects of healing. Healing depends also on the behavior of patients, of those who pay for services, of those who hire healthcare professionals. And in general, ethics is about the things that we can control. I believe healthcare professionals should try to treat everyone regardless of their merit, to the best of their abilities, while humbly accepting their limitations, and to the extent that they are in a position to advocate for their patients and for appropriate healthcare coverage, they should do so out of love of neighbor. All this sounds great. I have to say I really appreciated what Deacon Nash said this morning, though, and which is so, orthodox, that when you're part of a broken system, you are affected by this. And there is moral injury, there's need for healing. And I think for healthcare providers, this issue of treating what is treatable is often a source of incredible distress, because it can be so difficult, not only for individual reasons, but given the healthcare system. So conferences like this, I think, are very important to heal the healer to carry on the mission. But now, does this mean healthcare professionals must provide whatever services that a patient requests? For reasons of time, I'm going to skip my discussion of demands for so-called feudal treatments of an illness. I rather want to focus on treatments such as the following, which healthcare professionals now regularly provide upon request. Psychotropic medications aimed at optimizing alertness and focus, elective abortions, psychotherapy aimed at helping a person accomplish personal goals, which may or may not be healthy or even moral, feminizing and masculinizing medications and surgeries, plastic surgeries such as buttocks or breast enhancement or even hair replacement, assisted suicide, medical assistance in dying, prenatal genetic testing for sex and other trait selection. The list is endless right now, and it keeps growing. Do you know there are now more genetic tests than there are genes in the human body? Okay, this is proliferating rapidly. So Elena Books calls these wish-fulfilling medical interventions because they primarily fulfill a wish that's not related to the treatment of an illness or a disease. And there's at least 3 arguments put forward in favor of these wish-fulfilling medical interventions. They're based on the concepts of autonomy, the concept of health, and consumerism. And I'll take each of these in turn separately, though in many ways they're interdependent. I've thought of the analogy of they're notes in a chord that's being played right now, this chord being the secular vision of healthcare. So the first note in the chord is autonomy. Florence Ashley argues in defense of transgender interventions by comparing them to reproductive health care. And they note that with birth control, abortion, and gender transition, there's not an illness being treated. Rather, what is at stake is autonomy. This is their view on this. Ashley concedes that some abortions are performed to save the life of the mother, and some parents seek transgender treatments for their children in hopes of reducing suicide. But still, Ashley argues that no such therapeutic aim underlies most requests for these services, and nor do they need to. All right, Ashley's trying to say, just like the states now guarantee a right to abortion, and it's funded by many government plans. Certainly that's true with birth control. It should be similar with gender transition. The U.S. courts have at times adopted this logic, but not always. But regardless of where the courts fall on these matters, within medical ethics, government-funded health plans, and professional training programs, there's a growing sense that patients have a right not only to customary health care aimed at healing, but also to wish-fulfilling medical interventions, and autonomy is invoked as the ground for this. From an Orthodox perspective, such autonomy arguments really carry no weight in terms of medical ethics. As we saw, the Orthodox Church highly values freedom, but it would never recognize a right to freely impose on others obligations that are tied to a self-focused concept of existence, meaning, and the mystery of human life. The second note in the cord, the definition of health. So John Ruda and his colleagues, they begin with the same observations about what's going on. They talk about wish-fulfilling medicine, and they appeal to autonomy to justify it. However, they also observe that the view of health care that they're presenting here, this view, is perfectly in line with the World Health Organization's definition of health. The WHO defines health as, quote, a state of complete physical, mental, and social well-being, and not merely the absence of disease or infirmity. This is essentially a claim that to be healthy is to enjoy perfect human well-being. Ruda therefore concludes that anything that an individual believes would foster physical, mental, or even social well-being is healthcare, right? So now this wish-fulfilling medicine truly becomes healthcare if you adopt this vision of what health is. First of all, just the nonsense of any kind of perfectionistic concept, like the WHO concept of health, this has been known at least since the 11th century, when Anselm of Canterbury put forward his ontological argument for God, saying God is that greater than which nothing else can be conceived. People argued with him. Guanilo said this is silly and used an example of a perfect island. Well, everyone agreed there's no coherent notion of a perfect island. Similarly, there is no coherent notion of perfect human health. It just simply doesn't exist. How tall should someone be? How much food should they need? How much sleep should they need, right? How long should they live? It is an absolutely subjective and moving answer that we would give. There is no coherence. There is no way to answer this because we are finite. From an Orthodox perspective, such a definition denies our nature as finite, embodied creatures who will certainly die. It further justifies a consumer view of medicine as a profession that can satisfy our strongest passions. The third note in the cord is consumerism. Medicine has gone through periods of tremendous paternalism. There were times when physicians would unilaterally make decisions whether to tell someone that they had cancer, whether to attempt resuscitation following cardiac arrest, whether to hospitalize a psychiatric patient long-term, all made just on their own without dialogue with patients, families. There's been a strong push toward shared decision-making that has sometimes gone hand in hand with a consumer view of medicine. That is the positive side, which has empowered patients and offered some correction to a paternalism within medicine. However, the combination of medical consumerism with the growing array of services that can be offered is really problematic in multiple ways. First, it will erode patient freedom. One might think that fulfilling patient wishes serves autonomy more than customary healthcare, but the opposite is the case. Capitalism in the world of advertising know how easy it is to manufacture desires and perceived needs. And a lot of this is done through the social media that we've heard discussed repeatedly throughout this conference. To shift healthcare away from prevention and cure of disease to wish fulfillment is to create an endless market for healthcare capitalists. Second, consumerism will erode medical professionalism. Already in 1980, Leon Cass observed that once we begin to treat medicine not as an art or a profession that is practiced, but as a technical service that is delivered and consumed by patients, we're in trouble. Quote, this new understanding shifts the focus to buying and selling, to the relation of exchange, and away from the mysterious activity of healing and the crucial and incomparable interpersonal bonds of the healing relation. Finally, a consumerist vision of medicine will inevitably leave the poor behind. Already the US spends more on healthcare than any other nation, while millions of people have no insurance and have difficulty accessing treatments for serious health needs, and this is obviously contrary to the gospel of Christ. So I want to clarify two things before drawing a couple conclusions and jumping into discussion. First, not all aspects of wish-fulfilling medicine are bad, just like not all aspects of a consumer view are bad. While going beyond the mission of preventing and treating illness, medicine may help people displace children for motives that are reasonable, and cosmetic procedures are not always wrong. For example, consider surgeries following a basic correction of cleft palate. Second, the line between treatment of disorders and enhancements is often fuzzy. Think of the new blockbuster drug Ozempic or gastric bypass surgery for someone who wishes to lose weight, both for reasons of health and for appearance. And what about efforts to restore normal functions due to aging? Is this healing or enhancement? And I ask this while gratefully wearing eyeglasses that correct my aging vision, right? I wasn't born blind. I don't have an illness. It's just simple aging that would make it very hard for me to do my job if I couldn't read well, right? So those are the caveats or qualifications. All this is to say, wish-fulfilling medicine is not always bad, and it's not always clearly distinct from customary medicine. Nevertheless, I think we can draw some conclusions here. The first is that the commonly held view in the U.S. in U.S. law and bioethics, that a patient should consent to treatments, is fully consistent with Orthodox thinking. God made us free and respects our freedom, even our freedom to resist what is good. But we are not truly autonomous. It's delusional to think we can generate moral laws and impose obligations on others. When healthcare professionals owe services to patients, it is due to their dignity as children of God, and because the professionals have trained and professed to heal. Second, demands for wish-fulfilling rather than healing medical interventions are growing and will grow. Within some secular circles, there's a push to require that such services be provided and publicly paid for. Sometimes we also observe an erosion of so-called conscientious objection protections. However, healthcare professionals who embrace a mission of prevention, healing, and palliation have a moral right to restrict their scope of practice to this. I believe it's prudent for Christian and other customary healers to consider whether our society needs new professional associations and even professional titles to secure the scope of practice for those who wish to be only healers and not service providers. Just as physical therapists do not need to apologize for not prescribing opioids, so too someone committed to healing should not need to apologize for limiting their scope of practice. So I'll end there and open up for discussion. Thank you.
Thank you. I run into this with diagnosing ADHD, where a person is requesting stimulant, and it's there are good arguments for thinking of ADHD as a kind of social construct, and they're good arguments for it.
Yeah.
And so it just brings up the question I often have in my mind is prescribing something to someone that in some ways does kind of indirect harm to their classmates, in the sense that this person is taking some enhancement, may not necessarily have this particular deficit, and gives themselves an edge as compared to their peers. And I don't know if you could comment on that, or just if there's anything to apply from what you said in relation to that.
Well, I'm not going to answer the question as to whether you should specifically,
Yeah, sure.
provide those medications. But what I would say is I do think we need to increase our healthcare professionals' sense that they have been trained to exercise their judgment as to how best to heal someone, and that their primary purpose is to serve as a healer, right? So I would just encourage you to feel confident and empowered that that's your mission as a healer and to exercise that judgment. Yeah. Please.
Jim, wonderful talk. Great paper. I have three quick comments, right?
Yeah.
One is I think we should go to war against the common term of paternalism.
Yeah.
I mean, mid-19th century, I think, all of a sudden being a father is a pejorative. That being a father is automatically associated with tyrannical despot. And though my daughters may call me that, it's not always necessarily true. But it is a curiosity that paternalism becomes this pejorative by the mid-19th century. And it, from that, I think we use it usually in shared decision making, but if we unpack it a bit, there is this rejection of the authority. I think there's more to it. There's a different movement. Right? I think we should try to focus on that just a little bit. Two, that was just a side comment. In general, the church amendments and HHS and the Office of Civil Rights have affirmed, reaffirmed religious liberty and conscientious refusal, even under the or conscientious objection. But it is losing ground. Obviously, it lost in Canada with voluntary active euthanasia and assisted suicide. In the place in the States that it really was lost was when, in the Benitez case, where the Supreme Court of California declared medicine, really for the first time, a public accommodation. That means medicine had never been considered a public accommodation because of the professional practice. A physician could say yes or no, and no one's going to force a physician to do something or treat anyone they don't want to treat. It's still true for surgeons. No one wants an angry surgeon. That's the principle there. But with Benitez was a lesbian woman who was seeking in vitro fertilization. And the California Supreme Court found in favor of Benitez that the IVF clinic had to functionally, it really closed a lot of reproductive centers. So that's the one place it looked like things were going very quickly against the kind of classic legal protections we have in the U.S. on conscientious grounds. The third quick comment is I tried for a decade to organize multiple different Christian, religious, and other groups of professionals. Because there's all these different groups, Catholic Medical Association, Christian Medical and Dental Association, all these different groups. I tried with Far Curlin and Dancel Macy, and we tried for a decade to coalesce them to work together, to form something that would be more of a, at least a lobbying group, to make sure that, because the kind of Marcusian road that we're on right now is you use the language of toleration until the progressive change is made, and then you don't tolerate the former position. And I just, those groups don't work well together. I've become, so my hope is that we can create professional societies that will allow just medicine, just just healers, I want to treat disease, I'm not going to and help patients and caring professionals, or so I'm not all that optimistic about the realization. And one of my tactics has kind of shifted. I've actually tried to lean into the DEI language. To say what we must do is really take diversity seriously. And that diversity, if you're going to really be inclusive and really take diversity seriously, that's going to include ethical, moral, religious, and political diversity. Right. And that's gotten a little more resonance.
For now, because that's the fashionable language right now. And I'm doing the same. I'm writing a grant with Biola University. I'm at WashU, a very secular medical research school, and we're trying to do a project that we're approaching NIH for funding, partly in the name of this is reaching out to a new group, a small evangelical Bible college, to look at ethical, legal, social issues in genomics, and I'm sure Asim Padella, a Muslim physician, is doing the same with some real success and is doing a great job with it. I would also say, I think things will get worse, and I think they already are worse than the few limited cases of conscientious objection losses. I think we spoke yesterday of a colleague of yours who wasn't hired by an institution because he wouldn't prescribe contraceptives. And there's a lot of discrimination going on, a lot of people who feel that they're in the moral right to not hire someone, to not graduate a student, unless they're willing to offer the full array of services that have become standard and paid for. And I agree with you on paternalism.
Yeah, I will say in terms of medical training, as like a resident going through medical school, it is explicitly told. We were not by other physicians oftentimes, but by our legal and social work colleagues in a secular, our medical ethics would tell us if you're Christian or if you hold certain beliefs, you should leave the room, you shouldn't complete your degree. And so most of us fall.
Yeah, that's illegal actually.
Yeah.
It is illegal,
So,
but that's my point. There's a lot of illegal things happening right now.
I'm happy to connect you with some friends of mine.
Yes, and sometimes, and I think when people would say it, they would either say it secretly well, and then they would change their phrasing to try and backtrack some of their statements. And most of these were not physicians, but it was a part of our formal medical education, and I think at the very least, there are definitely places that it's hostile, and I think discourages a lot of people to even go into the field.
I agree. It's a situation that you cannot report, right? Like there were subtle hints for me to cover my cross or tuck in my cross, and then I guess when I didn't respond, it became very. It caused a lot of tension, and so I was outwardly told, you should not carry or do anything that is religious. We know you have a tattoo, but the cross you can hide. Because I have a cross tattoo also, so I have that stamp. And my response was, you let people have green hair, let me wear my cross. But at the same time, I'm not going to hide it. I'm not going to lie and say that I wasn't terrified enough as a new medical student.
Yeah, and you can report that. You can.
Yeah.
I mean, we get those reports. I mean, look, and this is where we can give some things for our Muslim students and colleagues who will make a stand. Who say, I can't pray. I'm going to pray. You're going to make me attend this class during prayer hour. I'm going to go outside and pray. And you're not going to stop. And so, it depends on who finding the right friend, I think, who's going to be an advocate in the system. Because what office to report to really depends on the personnel in those offices. But those are all reportable. It is discrimination, and it is illegal in most states.
It's a genuine complication, though, of empowering yourself. There's risks. Like, I just work in a system where if I denied someone a stimulant, there just would be strong reactions to that.
Oh, I'm certain.
Yeah. So it puts a kind of dilemma for me in terms of what to do about that.
Yeah.
Yeah, there is a distinction between whether there's a claim of following a standard of care for a certain patient population versus because you are a Christian or because you're wearing a cross, you may not. Those are protected. Those are protected from discrimination in most state codes, and especially at state universities. I mean, the worst are like the former Christian health systems and universities that still think that they still have a zeal to evangelize the world, but it's with neo-Marxism. So they're the most hostile, but especially secular public universities, those things are very protected. People don't know that because in their societies, they will have an expectation. I mean, we're both professional bioethicists, but we do not represent bioethics as a whole, right? And if you ask most bioethics views, I mean, most will not agree with some of the positions that Jim and I will share. So when they're teaching, they'll teach what they think is just obvious, but they usually are very ignorant of the law and the protections that Christians have. We should not be afraid.
So we're at time. So if anyone wants to stay and have further dialogue in here, you're welcome to. But for those that want to check out the exhibits or have just a break for a few minutes, we reconvene at 4 for the last round of workshops.
Thank you.